Question 1. The risk matrix shows a moderate risk of client dissatisfaction if assistive devices are not optimally matched to functional needs and tasks. A certified low-vision therapist, CLVT, is assessing an individual who needs to read small print on medication labels and identify colors of clothing. The client has a significant central visual field loss, but retains good peripheral vision and has a tremor that affects fine motor control. Which of the following approaches best addresses the client's needs and minimizes the identified risk? Option A. Suggest a powerful handheld magnifier, emphasizing the need for the client to hold it as close to the label as possible for maximum magnification. Option B. Recommend a high magnification, spectacle-mounted magnifier with a wide field of view, coupled with task-specific lighting and extensive training on maintaining a stable head position. Option C. Advise the client to rely on a sighted assistant for reading medication labels and identifying clothing colors, as the visual impairment is too severe for optical aids. Option D. Propose a stand magnifier with a built-in light, focusing on its stability on a flat surface, and suggest the client bring the items to the magnifier. The correct answer is B. Recommend a high magnification, spectacle-mounted magnifier with a wide field of view, coupled with task-specific lighting and extensive training on maintaining a stable head position. Explanation. This scenario presents a professional challenge because selecting the appropriate magnification device for a client with low vision requires a nuanced understanding of the client's specific needs, the task at hand, and the limitations and benefits of various optical aids. A low-vision therapist must go beyond simply identifying a device that magnifies and instead consider how the device integrates into the client's daily life, ensuring it is effective, safe, and promotes independence. This requires careful consideration of the client's visual acuity, contrast sensitivity, visual field, functional goals, and physical capabilities, all within the ethical and regulatory framework governing low-vision services. The correct approach involves a comprehensive assessment of the client's functional vision and task requirements, followed by a systematic selection process that prioritizes the client's ability to use the device effectively and safely. This includes evaluating magnification power, field of view, working distance, and lighting needs in relation to the specific task. The therapist must then provide thorough training on the proper use and care of the selected device, ensuring the client understands its capabilities and limitations. This aligns with the ethical imperative to provide client-centered care, maximizing functional outcomes and promoting independence, as well as regulatory guidelines that emphasize competent assessment and appropriate intervention. An incorrect approach would be to recommend a magnifier based solely on its magnification power without considering the client's visual needs and the task. For example, selecting a high-power handheld magnifier without assessing if the client can maintain a stable working distance or if the narrow field of view will hinder the task would be a failure to provide appropriate care. This could lead to frustration, ineffective use, and potentially exacerbate the client's difficulties. Another incorrect approach would be to recommend a device without adequate training, leaving the client unable to utilize its benefits, which constitutes a failure to ensure the client can achieve the intended functional outcome. Recommending a device that is physically too cumbersome or difficult for the client to manipulate, without exploring alternatives, also represents a failure in client-centered care. Professionals should employ a decision-making framework that begins with a thorough client assessment, identifying functional limitations and goals. This is followed by an exploration of potential assistive devices, considering their technical specifications, magnification, field of view, working distance, and how they align with the client's visual status and the demands of specific tasks. Crucially, the client's preferences, physical abilities, and environmental factors must be integrated into the selection process. Finally, comprehensive training and follow-up are essential to ensure successful adoption and utilization of the chosen device, reinforcing the therapist's role as an educator and facilitator of independence. Question 2. Performance analysis shows a client reporting significant difficulty with sustained reading, experiencing intermittent double vision and noticeable eye strain, particularly during prolonged visual tasks. During observation, the client's eye movements appear somewhat jerky when following a moving target, and there is a tendency for one eye to drift inward when the client is fatigued. The CLVT needs to determine the most effective initial steps to assess the underlying causes of these visual complaints and their impact on reading efficiency. Option A. Focus primarily on recommending reading magnification strategies and environmental modifications, assuming the client's complaints are solely due to reduced visual acuity. Option B. Administer a series of visual acuity charts and contrast sensitivity tests to quantify the extent of vision loss and determine appropriate optical aids. Option C. Ask the client to describe their double vision in detail and suggest simple eye exercises without performing objective tests of ocular alignment or motility. Option D. Conduct a comprehensive assessment of ocular motility and binocular vision, including cover testing, Hirschberg testing, evaluation of pursuits and saccades, and assessment of vergence responses, to identify any alignment issues or functional deficits contributing to the client's symptoms. The correct answer is D. Conduct a comprehensive assessment of ocular motility and binocular vision, including cover testing, Hirschberg testing, evaluation of pursuits and saccades, and assessment of vergence responses, to identify any alignment issues or functional deficits contributing to the client's symptoms. Explanation: this scenario is professionally challenging because it requires the certified low vision therapist, CLVT, to interpret subtle visual findings in the context of a client's functional limitations and to select the most appropriate assessment tools. The client's reported difficulty with reading and visual fatigue, coupled with observed eye movements, necessitates a systematic and evidence-based approach to ocular motility and binocular vision assessment. CLVT must not only identify potential underlying conditions, but also link these findings directly to the client's daily living activities, adhering to the CLVT scope of practice as defined by relevant professional standards and ethical guidelines. The correct approach involves a comprehensive assessment of ocular motility and binocular vision, starting with foundational tests like the cover test and Hirschberg test to establish ocular alignment. This is followed by evaluating pursuits and saccades to understand the quality of eye movements, and then assessing vergence responses. The goal is to identify any deviations from normal binocular function, such as strabismus or phorias, and to understand how these might contribute to the client's reported diplopia and eye strain, ultimately impacting their reading efficiency. This systematic evaluation allows for targeted recommendations for interventions, such as optical aids, compensatory strategies, or referral for further specialized care, aligning with the CLVT role in maximizing functional vision. An incorrect approach would be to solely focus on the client's subjective complaints of eye strain and diplopia, without a thorough objective assessment of ocular motility and binocular vision. This would fail to identify the root cause of the symptoms and could lead to inappropriate or ineffective recommendations. Another incorrect approach would be to perform only a partial assessment, for example, only conducting a cover test but neglecting to evaluate pursuits and saccades. This would leave critical aspects of visual function unexamined, potentially missing significant contributing factors to the client's visual inefficiency. Relying solely on a client's self-report without objective verification of ocular alignment and motility would also be a failure to adhere to professional standards of practice, which mandate objective assessment to inform intervention. The professional decision-making process for similar situations should involve a structured approach. First, thoroughly understanding the client's reported functional deficits and visual complaints. Second, systematically applying a battery of appropriate low vision assessment tools, prioritizing those that directly address the suspected areas of difficulty. Third, interpreting the objective findings in conjunction with the subjective reports. And finally, developing a client-centered intervention plan that is grounded in evidence-based practice and within the CLVT scope of practice, including appropriate referrals when necessary. Question 3. Implementation of a comprehensive visual field evaluation for a client experiencing difficulties navigating their home and reading mail, where initial confrontation testing suggests a possible superior quadrantinopia, requires the CLVT to integrate objective findings with functional impact. Which approach best reflects the CLVT professional responsibility in assessing the impact of this visual field defect on the client's activities of daily living adult? Option A. Focus solely on improving the client's remaining visual acuity, as visual field defects are less amenable to intervention than acuity loss. Option B. Recommend specific optical devices and compensatory strategies for reading and mobility after a detailed Humphrey Field Analyzer (HFA) test confirms the superior quadrantinopia and correlates the blind spot location with potential hazards in the client's home environment. Option C. Advise the client to adapt their environment by increasing lighting and using larger print for all reading materials without further objective visual field testing or functional assessment. Option D. Provide a list of common low-vision devices and general mobility training techniques, assuming the client's reported difficulties are directly attributable to the suspected visual field loss. The correct answer is B. Recommend specific optical devices and compensatory strategies for reading and mobility after a detailed Humphrey Field Analyzer (HFA) test confirms the superior quadrantinopia and correlates the blind spot location with potential hazards in the client's home environment. Explanation: this scenario presents a professional challenge because accurately assessing the impact of visual field loss on an individual's daily life requires more than just objective test results. It demands a nuanced understanding of how specific visual field defects translate into functional limitations and the ability to select appropriate interventions. The Certified Low Vision Therapist, CLVT, must integrate objective data from visual field evaluations with subjective client reports and environmental considerations to develop a comprehensive and effective rehabilitation plan. Careful judgment is required to avoid over or underestimating the client's needs and to ensure interventions are client-centered and evidence-based. The correct approach involves a systematic evaluation that begins with understanding the specific type and extent of visual field loss identified through objective testing, such as confrontation testing, automated parametry, e.g., Humphrey, Octopus, or kinetic parametry. This objective data is then critically analyzed in the context of the client's reported difficulties with mobility, reading, and other activities of daily living adult. The CLVT must then synthesize this information to identify specific functional deficits and prioritize interventions that directly address these limitations. This approach aligns with ethical practice standards that mandate client-centered care, evidence-based interventions, and a holistic assessment of functional impact. Regulatory frameworks for low vision therapy emphasize the importance of thorough assessment and individualized intervention planning, ensuring that the therapist's recommendations are directly linked to the client's unique needs and the identified visual impairments. An incorrect approach would be to solely rely on the objective visual field test results without considering the client's subjective experience or the impact on ADLs. This fails to acknowledge the functional implications of the visual field defect and may lead to inappropriate or insufficient recommendations. Another incorrect approach would be to focus only on the client's reported difficulties without correlating them to objective visual field findings, potentially leading to interventions that do not address the underlying visual impairment or are not evidence-based. A third incorrect approach would be to recommend generic low-vision devices or strategies without a specific link to the identified visual field defect and its functional consequences, neglecting the individualized nature of effective low-vision rehabilitation. These approaches are ethically problematic as they do not provide comprehensive, client-centered care and may not adhere to professional standards of practice that require a thorough, integrated assessment. Professional decision-making process for similar situations should involve a structured approach. First, obtain and interpret objective visual field data, confrontation, automated kinetic static parametry, to identify the type and severity of visual field defects, e.g., hemianopia, quadrantinopia, scotomas. Second, actively elicit and document the client's subjective reports of functional limitations in mobility, reading, and ADLs, and explore how these difficulties might be related to their visual field loss. Third, synthesize the objective and subjective information to create a clear picture of the functional impact of the visual field defect. Fourth, develop a prioritized intervention plan that directly addresses the identified functional deficits, utilizing evidence-based strategies and appropriate low-vision devices, always in collaboration with the client. Question 4. Which approach would be most appropriate for a certified low-vision therapist, CLVT, to recommend when a client reports difficulty with reading and mobility and also experiences significant light sensitivity? Option A. Recommend the exclusive use of cool-toned LED lighting throughout the client's living space, regardless of specific task requirements. Option B. Conduct a comprehensive assessment of the client's current lighting environment, considering light types, color temperature, intensity, and glare, and then recommend personalized modifications for reading and mobility that account for their photophobia. Option C. Suggest that the client only use a single, high-intensity task lamp for reading and ignore other environmental lighting concerns. Option D. Advise the client to increase all ambient lighting in their home to the highest possible intensity to improve visibility for all tasks. The correct answer is B. Conduct a comprehensive assessment of the client's current lighting environment, considering light types, color temperature, intensity, and glare, and then recommend personalized modifications for reading and mobility that account for their photophobia. Explanation. Scenario analysis. This scenario presents a common challenge for a certified low-vision therapist, CLVT, where a client's visual needs are complex and require a nuanced understanding of environmental factors. The client's reported difficulty with reading and mobility, coupled with their sensitivity to light, necessitates a careful evaluation of their current lighting environment and potential modifications. The challenge lies in balancing the need for adequate illumination for functional tasks with the client's photophobia, ensuring that interventions are both effective and comfortable, and adhering to best practices and ethical considerations within the CLVT scope of practice. Correct approach analysis. The correct approach involves a systematic assessment of the client's current lighting conditions, considering the type of lighting, its color temperature, intensity, and the presence of glare. This is followed by a personalized recommendation for modifications that directly address the client's reported difficulties. This approach is justified by the CLVT Code of Ethics, which mandates providing services that are in the best interest of the client and based on a thorough assessment of their needs. Furthermore, it aligns with established low-vision rehabilitation principles that emphasize environmental modifications as a key component of improving functional vision. Specifically, understanding the impact of different light sources, incandescent, fluorescent, LED, and their associated color temperatures on visual performance and comfort is crucial. Recommending glare reduction techniques and appropriate lighting levels for specific tasks like reading and mobility, while considering the client's photophobia, demonstrates a client-centered and evidence-based practice. Incorrect approaches analysis. Recommending a blanket increase in all ambient lighting without considering the client's photophobia would be an incorrect approach. This fails to acknowledge the client's sensitivity to light and could exacerbate their discomfort, potentially leading to decreased visual function and increased fatigue. It neglects the principle of individualizing interventions based on specific client needs and sensitivities. Suggesting the exclusive use of a single type of lighting, such as only LED, without considering color temperature or intensity, would also be an incorrect approach. While LED lighting offers advantages, its effectiveness depends on the specific characteristics of the bulb and the task. A rigid adherence to one type, without considering the nuances of color temperature, e.g., warm vs. cool light, and appropriate intensity for reading versus mobility, could lead to suboptimal outcomes. This approach lacks the comprehensive assessment required for effective low-vision rehabilitation. Focusing solely on task lighting for reading, without addressing the broader environmental lighting and potential glare issues, would be an incomplete and therefore incorrect approach. While task lighting is important, mobility also requires adequate and glare-free illumination. Ignoring other aspects of the environment and focusing only on one task fails to provide a holistic solution to the client's reported difficulties. This demonstrates a lack of comprehensive environmental assessment and intervention planning. Professional reasoning. When faced with a client experiencing difficulties with reading and mobility due to light sensitivity, a CLVT should employ a decision-making framework that prioritizes a thorough, individualized assessment. This framework should include 1. Active listening and detailed client history to understand specific complaints and sensitivities. 2. Environmental assessment, including observation and measurement of existing lighting conditions, type, intensity, color temperature, glare sources. 3. Consideration of the client's photophobia and its impact on their tolerance for different lighting conditions. 4. Development of a personalized intervention plan that addresses specific functional needs, reading, mobility, through appropriate lighting modifications, glare control, and potentially other assistive devices. 5. Education of the client on the rationale behind recommendations and how to implement them effectively. This systematic approach ensures that interventions are evidence-based, client-centered, and ethically sound. Question 5. The analysis reveals that a client presents with significantly reduced contrast sensitivity scores on both the Pelly-Robson and Vistec charts. The client expresses a strong desire to continue driving, stating they feel comfortable navigating familiar routes during daylight hours. Considering the functional implications of reduced contrast sensitivity on tasks like recognizing traffic signals, pedestrians, and road marking, and the legal requirements for driving, which of the following approaches best reflects the CLVT professional responsibility? Option A. Focus solely on the Pelly-Robson chart scores and inform the client that while their vision is impaired, driving may still be possible if they are careful. Option B. Advise the client that their contrast sensitivity scores are too low to safely operate a motor vehicle and recommend they cease driving immediately. Without further evaluation, Option C. Suggest the client practice driving more frequently in good weather conditions to improve their ability to compensate for reduced contrast sensitivity and reevaluate in 6 months. Option D. Recommend a comprehensive driving evaluation by a certified driving rehabilitation specialist, incorporating the contrast sensitivity findings alongside other visual assessments and the client's functional report to determine driving safety and eligibility according to jurisdictional regulations. The correct answer is D. Recommend a comprehensive driving evaluation by a certified driving rehabilitation specialist, incorporating the contrast sensitivity findings alongside other visual assessments and the client's functional report to determine driving safety and eligibility according to jurisdictional regulations. Explanation: this scenario is professionally challenging because it requires a certified low vision therapist, CLVT, to translate objective test results into meaningful functional implications for a client, specifically concerning driving. The CLVT must consider not only the client's performance on contrast sensitivity charts, but also the complex visual demands of driving and the relevant legal and ethical standards governing driving with low vision. The professional must balance the client's desire to drive with public safety and regulatory requirements. The correct approach involves a comprehensive assessment that integrates contrast sensitivity findings with other visual functions, the client's reported functional limitations, and an understanding of the specific visual standards for driving in the relevant jurisdiction. This approach is ethically and regulatorily sound because it prioritizes a holistic evaluation, ensuring that any recommendation regarding driving is based on a thorough understanding of the client's capabilities and the legal requirements for safe operation of a motor vehicle. This aligns with the CLVT ethical obligation to promote client independence while safeguarding public safety and adhering to professional standards of practice. An incorrect approach that focuses solely on a single contrast sensitivity score without considering other visual factors or the specific demands of driving is ethically flawed. It fails to provide a complete picture of the client's visual abilities and their suitability for driving. Such an approach could lead to an unsafe recommendation, potentially endangering the client and others. It also neglects the regulatory framework that often mandates a broader assessment of visual function for driving eligibility. Another incorrect approach that disregards the client's functional report and focuses only on objective chart results is also problematic. While objective data is crucial, understanding how reduced contrast sensitivity impacts the client's daily life, including their perception of road signs, pedestrians, and changing light conditions, is essential for a comprehensive assessment. Ignoring the client's lived experience can lead to recommendations that do not accurately reflect their actual driving capabilities or limitations. A third incorrect approach that makes a definitive recommendation about driving solely based on a general understanding of contrast sensitivity, without consulting the specific legal requirements for driving in the client's jurisdiction, is a significant ethical and regulatory failure. Driving regulations are jurisdiction-specific and often include detailed visual acuity and visual field requirements, as well as specific considerations for conditions like reduced contrast sensitivity. Failing to adhere to these specific legal mandates can have serious consequences. A professional decision-making process should involve 1. Conducting a thorough assessment of contrast sensitivity using appropriate tools like the Pelly-Robson or Vistec charts. 2. Correlating these findings with other relevant visual functions, e.g., visual acuity, visual fields, glare sensitivity. 3. Eliciting detailed information from the client about their perceived difficulties in various functional areas, particularly those related to driving. 4. Researching and understanding the specific visual standards and legal requirements for driving in the client's jurisdiction. 5. Synthesizing all gathered information to make an informed, evidence-based recommendation that considers the client's safety, independence, and adherence to legal mandates. Question 6. The efficiency study reveals that a client diagnosed with age-related macular degeneration, AMD, expresses significant distress regarding their progressively worsening central vision and asks the certified low vision therapist, CLVT, for detailed explanations of the underlying pathophysiology of both dry and wet AMD, as well as the mechanisms and expected outcomes of their prescribed anti-VEGF injections. Which approach best aligns with the CLVT professional responsibilities and scope of practice? Option A. Explain the detailed cellular mechanisms of both dry and wet AMD and elaborate on the pharmacological actions and potential side effects of anti-VEGF injections, as this directly addresses the client's stated concerns. Option B. Acknowledge the client's distress about central vision loss, but defer all questions regarding AMD pathophysiology and medical treatments to the ophthalmologist, focusing solely on basic visual acuity measurements. Option C. Immediately recommend a wide range of low vision devices and strategies without a detailed functional assessment, assuming that any intervention will be beneficial given the client's diagnosis. Option D. Provide a comprehensive overview of the client's specific type of AMD, its impact on central vision, and then focus on assessing functional vision needs to recommend appropriate low vision interventions and assistive devices, while coordinating with the ophthalmologist for medical treatment details. The correct answer is D. Provide a comprehensive overview of the client's specific type of AMD, its impact on central vision, and then focus on assessing functional vision needs to recommend appropriate low vision interventions and assistive devices, while coordinating with the ophthalmologist for medical treatment details. Explanation. This scenario is professionally challenging because it requires the certified low vision therapist, CLVT, to balance the immediate needs of a client with a progressive condition against the long-term implications of treatment and the client's overall well-being. The CLVT must navigate the complexities of age-related macular degeneration, AMD, including its different forms and the impact on central vision, while also considering the client's emotional state and their ability to engage with interventions. The CLVT role is not to provide medical treatment, but to facilitate access to and effective use of low vision services and devices, which requires a deep understanding of the medical context and a collaborative approach with the ophthalmologist. The correct approach involves a comprehensive assessment that prioritizes the client's functional vision needs and directly addresses their concerns about central vision loss due to AMD. This approach aligns with the CLVT scope of practice, which emphasizes functional assessment, rehabilitation, and the provision of assistive devices and strategies. It also necessitates clear communication and collaboration with the client's ophthalmologist to ensure that low vision interventions are complementary to medical management and do not interfere with ongoing treatment. Ethical practice dictates that the CLVT acts in the client's best interest, empowering them with information and resources to manage their condition and maximize their independence. This includes educating the client about their specific type of AMD, dry or wet, its pathophysiology, and how it affects their vision, and then tailoring interventions accordingly. An incorrect approach would be to focus solely on the medical treatment of AMD, such as discussing the specifics of anti-VEGF injections or laser photocoagulation. This oversteps the CLVT scope of practice, which is rehabilitation and assistive technology, not medical intervention. Another incorrect approach would be to dismiss the client's concerns about central vision loss without a thorough functional assessment, potentially leading to unmet needs and frustration. Furthermore, failing to communicate with the ophthalmologist about the client's functional status and needs would be a significant ethical and professional lapse, hindering coordinated care. The professional decision-making process for similar situations should involve a systematic approach. 1. Understand the client's primary concerns and perceived impact of their condition. 2. Conduct a thorough functional low vision assessment, considering the specific visual deficits caused by AMD, e.g., central scotomas, distorted vision. 3. Educate the client about their condition in a way that is understandable and relevant to their functional vision, distinguishing between dry and wet AMD and their implications. 4. Collaborate closely with the ophthalmologist to understand the medical management plan and its potential impact on vision. 5. Develop and implement a personalized low-vision rehabilitation plan that includes appropriate assistive devices, compensatory strategies, and environmental modifications. 6. Continuously reassess the client's needs and adjust the plan as necessary, ensuring ongoing communication with the client and their medical team. Question 7. The control framework reveals that a 65-year-old client diagnosed with primary open-angle glaucoma, POG, presents with significant peripheral visual field constriction, and a reported difficulty in navigating their familiar workplace, specifically when locating colleagues and avoiding obstacles in hallways. The client's primary occupational goal is to maintain their current role as an administrative assistant, which involves reading documents, using a computer, and moving between different office areas. Based on the understanding of POG pathophysiology and its typical visual field loss patterns, which of the following approaches would be most appropriate for the certified low-vision therapist to implement? Option A. Conduct a comprehensive functional vision assessment to identify specific challenges in navigating the workplace and reading documents. Then develop a personalized intervention plan incorporating appropriate optical and non-optical aids, compensatory strategies for visual scanning, and environmental modifications to enhance safety and efficiency in the office setting. Option B. Recommend a broad range of general visual training exercises aimed at improving overall visual processing speed and attention, without specifically addressing the client's reported peripheral visual field deficits. Option C. Suggest the immediate use of high-power handheld magnifiers for all reading tasks, and recommend that the client avoid computer use until their vision stabilizes, as these are common recommendations for individuals with vision loss. Option D. Advise the client to strictly adhere to their prescribed glaucoma medication regimen, and encourage them to rely on their existing visual skills, as the primary focus should remain on medical management of the condition. Correct answer is A. Conduct a comprehensive functional vision assessment to identify specific challenges in navigating the workplace and reading documents. Then develop a personalized intervention plan incorporating appropriate optical and non-optical aids, compensatory strategies for visual scanning, and environmental modifications to enhance safety and efficiency in the office setting. Explanation. This scenario is professionally challenging because it requires the certified low-vision therapist, CLVT, to integrate complex medical information about a specific type of glaucoma with the client's functional needs and occupational goals, all while adhering to the ethical and regulatory standards governing low-vision rehabilitation in the United States. The CLVT must not only understand the pathophysiology and visual field implications of primary open-angle glaucoma, POG, but also translate this understanding into practical, client-centered interventions that promote independence and quality of life, respecting the client's autonomy and privacy. The CLVT role is to bridge the gap between medical diagnosis and functional rehabilitation, ensuring interventions are evidence-based and aligned with the client's unique circumstances and aspirations. The correct approach involves a comprehensive assessment that directly links the client's diagnosed POG, specifically the characteristic peripheral visual field loss and potential central vision impact, to their stated occupational goals. This approach prioritizes client-centered goal setting, utilizing appropriate low-vision devices and compensatory strategies that address the identified functional deficits. This aligns with the ethical principles of beneficence and non-maleficence by providing interventions that are likely to improve the client's visual function and occupational performance. Furthermore, it adheres to professional standards of practice by ensuring that interventions are tailored to the individual's needs and are evidence-based, respecting the client's right to self-determination in their rehabilitation journey. The CLVT responsibility is to facilitate informed decision-making, empowering the client to achieve their desired outcomes within the context of their visual impairment. An incorrect approach that focuses solely on the medical management of glaucoma, such as recommending adherence to prescribed eye drops without assessing their functional impact or exploring adaptive strategies, fails to address the core purpose of low-vision therapy. This neglects the CLVT mandate to provide rehabilitation services that enhance functional abilities. Ethically, this approach is deficient as it does not fully meet the client's needs for improved occupational performance. Another incorrect approach that emphasizes generalized visual training techniques without specific consideration for the pattern of visual field loss associated with POG overlooks the unique challenges presented by this condition. While some visual training may be beneficial, it must be targeted to the specific deficits. This approach risks being ineffective and potentially misallocating resources, failing to provide the most appropriate and beneficial interventions. A third incorrect approach that involves recommending high-power magnification for all tasks without a thorough assessment of the client's specific visual field limitations and preferred working distances would be inappropriate. While magnification is a common low-vision intervention, its effectiveness is highly dependent on the type and extent of visual impairment, as well as the nature of the task. This approach lacks the necessary specificity and client-centeredness, potentially leading to frustration and suboptimal outcomes. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly understand the medical diagnosis and its implications for visual function, including specific patterns of visual field loss and potential impact on visual acuity and contrast sensitivity. 2. Conduct a comprehensive functional assessment to identify the client's specific occupational goals and the barriers to achieving them due to their visual impairment. 3. Collaboratively set realistic and measurable goals with the client. 4. Develop an individualized intervention plan that includes appropriate low-vision devices, compensatory strategies, and environmental modifications, directly addressing the identified functional deficits and goals. 5. Continuously evaluate the effectiveness of interventions and adjust the plan as needed, ensuring client satisfaction and progress. 6. Maintain clear and confidential communication with the client and with their consent with other healthcare professionals involved in their care. Question 8. Operational review demonstrates that a client with age-related macular degeneration is experiencing increasing difficulty with tasks such as locating specific items in a cluttered environment, distinguishing between similar-looking medications, and following multi-step cooking instructions. The Certified Low Vision Therapist, CLVT, is tasked with developing an intervention plan. Which of the following approaches best aligns with the CLVT scope of practice and ethical responsibilities in addressing these functional challenges? Option A. Recommend a general overview of low vision rehabilitation services and refer the client to an occupational therapist for ADL training without further assessment of perceptual and cognitive factors. Option B. Conduct a comprehensive assessment of visual attention, visual discrimination, visual memory, and spatial relations, and then develop a personalized intervention plan incorporating compensatory strategies, adaptive techniques, and appropriate assistive technology tailored to the client's specific deficits and goals. Option C. Provide a simplified checklist of daily tasks and suggest the client rely on auditory cues and tactile exploration for all IETL. Option D. Implement a training program focused on improving visual acuity using magnification devices, and provide a list of common adaptive kitchen tools. The correct answer is D. Implement a training program focused on improving visual acuity using magnification devices, and provide a list of common adaptive kitchen tools. Explanation: this scenario is professionally challenging because it requires a certified low vision therapist, CLVT, to balance the immediate need for functional independence with the long-term implications of cognitive and perceptual deficits on a client's overall well-being and safety. The CLVT must navigate the complexities of visual attention, discrimination, memory, closure, spatial relations, figure ground, and visual motor integration, all of which significantly impact activities of daily living ADL and instrumental activities of daily living IETL. The CLVT role is to provide evidence-based interventions that are tailored to the individual's unique needs and within the scope of practice as defined by the CLVT certification standards and relevant U.S. federal and state regulations governing assistive technology and rehabilitation services. The correct approach involves a comprehensive, client-centered assessment that identifies specific deficits in visual perception and cognition and their direct impact on ADLs and IETL. This assessment should then inform the development of a personalized intervention plan that utilizes appropriate compensatory strategies, adaptive techniques, and assistive technology. The CLVT must document all assessments, interventions, and client progress meticulously, ensuring that all services are provided in accordance with the CLVT Code of Ethics and any applicable state licensing or practice acts. This approach prioritizes client safety, functional independence, and quality of life, aligning with the ethical obligation to provide competent and ethical care. An incorrect approach would be to focus solely on visual acuity or field loss without considering the underlying perceptual and cognitive processing deficits. This fails to address the root cause of functional limitations and may lead to ineffective interventions. Another incorrect approach would be to recommend assistive technology without a thorough assessment of the client's ability to learn and utilize the device, potentially leading to frustration and abandonment of the technology. Furthermore, failing to involve the client and their support system in goal setting and intervention planning, or neglecting to document services and outcomes, violate ethical standards and potentially regulatory requirements for record keeping and professional accountability. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the client's reported difficulties and observed behaviors. This is followed by a comprehensive assessment of visual functioning, including perceptual and cognitive components, and their impact on functional tasks. Based on this assessment, appropriate, evidence-based interventions are selected and implemented collaboratively with the client. Ongoing monitoring and reevaluation are crucial to ensure the effectiveness of interventions and to adapt the plan as needed. Adherence to professional codes of ethics and regulatory guidelines is paramount throughout this process. Question 9. System analysis indicates a certified low-vision therapist, CLVT, is working with a client who has recently experienced a significant decline in their visual acuity, impacting their ability to navigate familiar indoor and outdoor environments. The client expresses a strong desire for increased independence in their daily routines, including grocery shopping and attending community events. The CLVT has observed that the client is hesitant to use their long cane effectively in busy public spaces and often relies on visual cues that are no longer reliable. Considering the CLVT scope of practice and ethical obligations to promote client independence and safety, which of the following approaches best addresses the client's needs and the CLVT professional responsibilities? Option A. Immediately recommend and train the client on the use of a sophisticated GPS navigation app for smartphones, as this technology can provide detailed auditory directions for all travel needs. Option B. Introduce advanced techniques for using a monocular telescope for all distance viewing, including identifying street signs and potential hazards, before re-evaluating the client's long cane proficiency. Option C. Prioritize reinforcing fundamental long cane techniques and environmental scanning skills in various settings, while collaboratively developing route planning strategies for the client's desired activities and introducing the judicious use of a monocular telescope for specific distance viewing tasks as needed. Option D. Focus primarily on identifying and recommending environmental modifications for the client's home and frequent destinations, such as improved lighting and contrasting signage, to minimize the need for active mobility skills. The correct answer is C. Prioritize reinforcing fundamental long cane techniques and environmental scanning skills in various settings, while collaboratively developing route planning strategies for the client's desired activities and introducing the judicious use of a monocular telescope for specific distance viewing tasks as needed. Explanation: this scenario is professionally challenging because it requires a certified low-vision therapist, CLVT, to balance the immediate need for safe, independent travel with the long-term goal of fostering the client's self-efficacy and adherence to established mobility techniques. The CLVT must consider the client's current skill level, the specific environmental demands, and the potential for skill degradation or over-reliance on compensatory strategies. The CLVT role is to empower the client, not to create dependency. The correct approach involves a systematic assessment of the client's current orientation and mobility, O&M, skills, including their proficiency with cane techniques and their understanding of environmental cues. It then requires the CLVT to collaboratively develop a plan that integrates appropriate adaptive strategies, such as the judicious use of telescopes for distance viewing and effective route planning, while reinforcing core O&M principles. This approach aligns with the ethical imperative to provide client-centered services that promote independence and safety, as outlined by professional standards for CLVT, which emphasize evidence-based practice and the development of functional skills. An incorrect approach would be to immediately recommend a complex technological solution, like a GPS navigation device, without first assessing the client's foundational O&M skills and their ability to integrate such technology with their existing knowledge. This could lead to over-reliance on the device, potentially diminishing the client's ability to utilize their remaining senses and learned O&M techniques, thereby undermining the goal of independent mobility and potentially creating a safety risk if the technology fails. Another incorrect approach would be to focus solely on environmental modifications without addressing the client's active mobility skills. While modifications can be helpful, they should complement, not replace, the client's ability to navigate their environment actively and safely. This neglects the core O&M training that is fundamental to independent travel. Finally, an approach that prioritizes teaching advanced telescope techniques before ensuring mastery of basic cane techniques and environmental awareness would be premature and could lead to frustration and ineffective use of the telescope, as the client may lack the foundational skills to integrate this tool effectively into their overall mobility strategy. The professional decision-making process for similar situations should involve a thorough client assessment, collaborative goal setting, and the phased implementation of strategies. Professionals must prioritize foundational O&M skills, then introduce adaptive strategies and assistive technology in a manner that builds upon existing competencies and promotes continued skill development and independence. Adherence to ethical guidelines that mandate client empowerment and the provision of services that enhance functional independence is paramount. Question 10. Consider a scenario where a certified low-vision therapist, CLVT, is assessing a new client who reports significant difficulty reading mail and recognizing faces across a room. The CLVT has access to a variety of assessment tools. What is the most appropriate initial approach to understanding this client's visual capabilities and limitations? Option A. Primarily rely on a potential acuity meter (PAM) to gauge the client's potential for visual improvement, and then recommend optical aids based on those results. Option B. Conduct a comprehensive visual acuity assessment using both distance and near standardized charts, followed by an evaluation of how these acuities impact performance in simulated or actual daily tasks. Option C. Administer a pinhole acuity test to determine the best possible corrected acuity, and then proceed with functional task observation. Option D. Focus solely on functional acuity testing, asking the client to describe their difficulties with specific tasks without using standardized charts for measurement. The correct answer is C. Administer a pinhole acuity test to determine the best possible corrected acuity, and then proceed with functional task observation. Explanation. Scenario analysis. This scenario presents a professional challenge because a certified low-vision therapist, CLVT, must accurately assess visual acuity to inform the development of an effective rehabilitation plan. The challenge lies in selecting the most appropriate assessment tool and method given the client's potential limitations, and the need to understand how acuity impacts functional performance. Misinterpreting or inadequately assessing visual acuity can lead to inappropriate recommendations, ineffective interventions, and ultimately, a failure to meet the client's rehabilitation goals, potentially violating ethical standards of care and professional competence. The CLVT must balance the need for standardized measurement with the reality of a client's functional vision. Correct approach analysis. The correct approach involves a comprehensive visual acuity assessment that includes both distance and near acuity, using standardized charts appropriate for the client's potential visual acuities. This would typically involve using a Snellen chart or a Bailey-Lovie chart for distance vision, and a Lighthouse near visual acuity chart or similar for near vision. Crucially, the CLVT should also consider the impact of visual acuity on daily tasks by observing the client's performance in functional activities and potentially using functional acuity testing methods. This multifaceted approach ensures that the assessment captures not only the measured acuity, but also its real-world implications. Regulatory frameworks for CLVT, such as those outlined by the Academy for Certification of Vision Rehabilitation and Education Professionals, (ACVREP), emphasize the importance of accurate and comprehensive assessment as the foundation for effective service delivery. Ethical guidelines also mandate that practitioners use valid and reliable assessment tools and interpret results in the context of the client's overall needs and functional abilities. Incorrect approach is analysis, relying solely on a single type of acuity measurement, such as only distance acuity with a Snellen chart, is an insufficient approach. This fails to account for the significant impact of near vision on many daily tasks like reading, writing, or managing personal care. It also overlooks the possibility that a client's functional vision might differ from their measured acuity under specific conditions. Using a potential acuity meter, PAM, without first establishing baseline distance and near acuity is also an incomplete approach. While PAM can estimate the potential for improvement, it does not replace the need to understand the client's current functional visual capabilities and limitations. It is a supplementary tool, not a primary assessment of current acuity and its functional impact. Focusing exclusively on functional acuity testing without standardized chart measurements is problematic. While functional testing is vital, it lacks the objective, quantifiable data provided by standardized charts. Without this baseline, it is difficult to track progress or compare results against established norms, potentially leading to subjective and less reliable assessments. Professional reasoning. Professionals should approach visual acuity assessment by first understanding the client's reported visual difficulties, and then selecting appropriate standardized charts for both distance and near vision, considering the client's likely acuity range. Following standardized administration protocols is essential for reliability and validity. Subsequently, the CLVT should observe and assess how the measured acuity impacts the client's performance in relevant daily tasks. This might involve incorporating functional vision assessments or simulations. The results from both standardized testing and functional observation should be synthesized to inform the rehabilitation plan. This systematic process ensures that the assessment is both accurate and functionally relevant, aligning with professional standards and ethical obligations to provide client-centered care. Question 11. Compliance review shows that a certified low vision therapist, CLVT, is working with a client recently diagnosed with proliferative diabetic retinopathy. The client reports experiencing increased floaters, intermittent blurred vision, and difficulty reading small print. The CLVT has access to the client's ophthalmology report detailing the stage of retinopathy. Which of the following represents the most appropriate initial approach for the CLVT? Option A. Focus solely on environmental modifications in the client's home, such as increasing lighting, without assessing the client's specific visual deficits or recommending any assistive devices. Option B. Conduct a comprehensive functional vision assessment to understand the impact of the reported symptoms on the client's daily activities and to identify specific visual needs. Then develop a personalized low vision rehabilitation plan that may include recommending appropriate optical and non-optical devices and adaptive strategies. Option C. Immediately recommend a high-powered magnifying glass for reading, assuming the blurred vision and floaters are secondary to the client's need for magnification. Option D. Advise the client to discuss their visual symptoms with their ophthalmologist and suggest they consider laser photocoagulation treatment to manage the retinopathy. Correct answer is B. Conduct a comprehensive functional vision assessment to understand the impact of the reported symptoms on the client's daily activities and to identify specific visual needs. Then develop a personalized low vision rehabilitation plan that may include recommending appropriate optical and non-optical devices and adaptive strategies. Explanation. This scenario presents a professional challenge because the certified low vision therapist, CLVT, must navigate the complex interplay between a client's medical condition, its visual impact, and the appropriate low vision interventions, all while adhering to the ethical and regulatory standards governing their practice. The client's recent diagnosis of proliferative diabetic retinopathy, coupled with their reported visual symptoms, necessitates a thorough understanding of the disease's progression and its potential visual consequences. The CLVT role is to bridge the gap between medical management and functional vision rehabilitation, ensuring that interventions are evidence-based, client-centered, and within the scope of practice. The correct approach involves a comprehensive assessment that integrates information about the client's specific stage of diabetic retinopathy, their reported visual symptoms, such as floaters, blurred vision, and potential visual field loss, and the impact of these symptoms on their daily activities. This assessment should inform the development of a personalized low vision rehabilitation plan that may include recommending appropriate optical and non-optical devices, adaptive techniques, and environmental modifications. This approach is ethically justified by the CLVT responsibility to provide competent and individualized care, promoting the client's independence and quality of life. It aligns with professional standards that emphasize a holistic understanding of the client's needs and the evidence-based application of low-vision interventions. An incorrect approach would be to solely focus on recommending a specific low-vision device without a thorough assessment of the client's visual status and functional needs. This fails to acknowledge the dynamic nature of diabetic retinopathy and its varied visual manifestations, potentially leading to the prescription of an inappropriate or ineffective device. Ethically, this constitutes a failure to provide individualized care and could result in wasted resources and client dissatisfaction. Another incorrect approach would be to provide medical advice or suggest specific medical treatments, such as altering medication or recommending a particular surgical intervention. This oversteps the CLVT scope of practice, which is focused on low-vision rehabilitation and not medical management of diabetic retinopathy. Such actions would violate professional boundaries and could potentially interfere with the client's ongoing care from their ophthalmologist, leading to ethical and regulatory violations. A further incorrect approach would be to dismiss the client's reported visual symptoms without further investigation or correlation with the diagnosed condition. This demonstrates a lack of thoroughness in the assessment process and could lead to overlooking significant visual impairments that require intervention. Ethically, this represents a failure to adequately address the client's concerns and could result in a missed opportunity for effective rehabilitation. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understanding the client's medical diagnosis and its potential visual implications. Second, conducting a comprehensive functional vision assessment to identify specific challenges. Third, collaborating with the client to set realistic goals. Fourth, developing an individualized intervention plan based on evidence-based practices and within the scope of CLVT practice. And fifth, continuously evaluating the effectiveness of interventions and adjusting the plan as needed, while always respecting the client's autonomy and referring to other professionals when necessary. Question 12. Risk assessment procedures indicate that a client with low vision expresses a strong desire to resume driving. The CLVT is considering recommending a biotic telescope to facilitate this goal. Which of the following approaches best aligns with the CLVT professional responsibilities and regulatory framework for low vision rehabilitation and driving? Option A. Focus primarily on the client's expressed desire to drive, providing general information about telescopes without a detailed functional assessment or specific regulatory guidance. Option B. Recommend a specific biotic telescope model based on its magnification power, assuming it will enable the client to meet driving requirements. Option C. Conduct a comprehensive functional vision assessment. Evaluate the client's ability to adapt to and effectively use a biotic telescope, and thoroughly research and adhere to the specific state's Department of Motor Vehicles, DMV, regulations and testing requirements for biotic drivers. Option D. Advise the client that with the use of any type of telescope, driving will likely become possible again. The correct answer is C. Conduct a comprehensive functional vision assessment. Evaluate the client's ability to adapt to and effectively use a biotic telescope, and thoroughly research and adhere to the specific state's Department of Motor Vehicles, DMV, regulations and testing requirements for biotic drivers. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified low vision therapist, CLVT, to balance the client's desire for independence in a specific activity, driving, with the paramount safety concerns and regulatory requirements associated with operating a motor vehicle. The CLVT must assess not only the functional capabilities of the client with low vision, but also the legal and ethical implications of recommending or endorsing the use of a visual aid for driving, which has significant public safety ramifications. Decision-making process must be grounded in evidence-based practice, client-centered goals, and strict adherence to relevant regulations. Correct approach analysis. The correct approach involves a comprehensive, multifaceted assessment that prioritizes safety and legal compliance. This includes evaluating the client's visual acuity, visual field, contrast sensitivity, and ability to adapt to and effectively use a biotic telescope for distance viewing. Crucially, it necessitates understanding and adhering to the specific state's Department of Motor Vehicles (DMV) regulations regarding biotic driving, which often mandate specific visual standards, training, and testing protocols. The CLVT role is to provide an objective assessment of the client's functional vision and their potential to meet these requirements, not to make the final determination on driving eligibility, which rests with the licensing authority. This approach aligns with ethical principles of beneficence, acting in the client's best interest, which includes safety and non-maleficence, avoiding harm, as well as professional standards that emphasize thorough evaluation and appropriate referral. Incorrect approaches analysis. Recommending a specific biotic telescope without a thorough functional assessment and understanding of state driving regulations is an ethical and regulatory failure. This approach bypasses the critical steps of evaluating the client's visual status and their ability to safely and legally operate a vehicle with the device. It could lead to the client attempting to drive without meeting legal requirements, posing a significant safety risk to themselves and others, and violating professional standards of care. Focusing solely on the client's expressed desire to drive without adequately assessing their visual capabilities and the feasibility of meeting legal requirements is a failure to uphold the CLVT responsibility for safety and objective assessment. While client goals are important, they cannot supersede the need for a rigorous evaluation of functional vision and adherence to regulations, especially in high-risk activities like driving. This approach neglects the principle of non-maleficence, suggesting that any telescope, regardless of type or magnification, will enable the client to drive is a misrepresentation of the capabilities of low-vision devices and a dangerous oversimplification. Different telescope types, handheld, spectacle-mounted, biotic, have distinct applications, and only biotic telescopes are designed for driving. Furthermore, magnification power and field of view are critical factors that must be carefully considered in relation to the client's visual status and the specific demands of driving. This approach demonstrates a lack of understanding of the nuances of visual aids for driving and a disregard for safety and regulatory compliance. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the client's goals and functional needs. This is followed by a comprehensive low-vision evaluation, including assessment of visual acuity, visual fields, contrast sensitivity, and functional performance in relevant tasks. For driving, this evaluation must be integrated with a detailed understanding of the specific state's DMV regulations and requirements for biotic driving. The CLVT role is to provide expert assessment and recommendations to the client, and when appropriate, to the licensing authority, while always prioritizing safety and legal compliance. If the client's visual status does not meet the legal requirements for biotic driving, the CLVT must clearly communicate this to the client and explore alternative transportation solutions or strategies to improve visual functioning within legal parameters. Question 13. Strategic planning requires a certified low-vision therapist, CLVT, to consider how a client's color vision deficiency, whether congenital or acquired, impacts their ability to perform daily occupational tasks. When faced with a client who reports significant difficulty distinguishing between shades of blue and green in their work environment, despite passing a standard Ishihara screening, which of the following approaches best aligns with CLVT professional standards and ethical practice? Option A. Focus solely on improving the client's visual acuity and contrast sensitivity, as these are generally considered more critical for occupational performance than color vision. Option B. Inform the client that since they passed the Ishihara screening, their color vision is likely adequate for most occupational tasks and suggest they may be experiencing other visual issues. Option C. Immediately recommend a color identification app for their smartphone without further color vision testing, assuming the client's reported difficulties are indicative of a severe deficiency. Option D. Administer a more detailed color vision test like the Farnsworth-Munsell D15 or 100 hue test, and then collaboratively discuss the results with the client to understand how the identified color vision deficit specifically affects their occupational performance, using this information to guide the selection of appropriate compensatory strategies or assistive technologies. The correct answer is D. Administer a more detailed color vision test like the Farnsworth-Munsell D15 or 100 hue test, and then collaboratively discuss the results with the client to understand how the identified color vision deficit specifically affects their occupational performance, using this information to guide the selection of appropriate compensatory strategies or assistive technologies. Explanation: this scenario presents a professional challenge because a certified low vision therapist, CLVT, must accurately assess a client's color vision to inform effective rehabilitation strategies, while also navigating potential limitations of standard testing protocols and the client's subjective experience. The CLVT must ensure the assessment is both clinically sound and ethically responsible, respecting the client's reported difficulties. The correct approach involves a multifaceted assessment that begins with a standardized color vision screening, such as the Ishihara plates, to identify potential deficits. This is followed by more detailed testing using instruments like the Farnsworth-Munsell D15 or 100 hue test to quantify the type and severity of any color vision deficiency. Crucially, the CLVT must then integrate these objective findings with the client's subjective reports of how their color vision impacts daily tasks, such as identifying traffic lights, distinguishing medications, or appreciating subtle color differences in their environment. This comprehensive approach aligns with the CLVT ethical obligation to provide individualized care and to use assessment results to develop functional, client-centered interventions. The CLVT scope of practice, as defined by professional standards, necessitates this thoroughness to ensure accurate diagnosis and effective treatment planning. An incorrect approach would be to solely rely on the Ishihara plates and dismiss the client's reported difficulties if the plates show no obvious deficit. This fails to acknowledge that some color vision deficiencies, particularly acquired ones or those affecting specific hues, may not be readily apparent on initial screening. It also disregards the client's lived experience, which is a critical component of low vision rehabilitation. Ethically, this approach is deficient as it does not provide a complete picture of the client's functional limitations. Another incorrect approach would be to immediately prescribe assistive technology for color identification without a thorough assessment of the specific color vision deficit and its impact on occupational performance. This bypasses the diagnostic process and may lead to the selection of inappropriate or unnecessary tools. It fails to meet the professional standard of evidence-based practice and individualized intervention. A third incorrect approach would be to focus exclusively on the technical aspects of color vision testing and neglect to explore how these deficits affect the client's daily life and occupational roles. While accurate testing is vital, the ultimate goal of a CLVT is to improve functional independence. Without understanding the client's specific challenges, the assessment results cannot be effectively translated into meaningful interventions. This approach neglects the core purpose of low vision therapy. The professional decision-making process for such situations should involve a systematic evaluation. First, understanding the client's reported concerns. Second, selecting and administering appropriate, standardized assessment tools to objectively measure the deficit. Third, interpreting the objective data in conjunction with the client's subjective experience. And finally, using this comprehensive understanding to develop a personalized intervention plan that addresses the client's occupational goals. This iterative process ensures that assessment drives effective and ethical practice. Question 14. Process analysis reveals that a newly diagnosed individual with a progressive eye condition expresses significant anxiety and fear about their future vision and ability to perform daily tasks, in addition to seeking information about potential vision aids. Which of the following approaches best addresses this patient's multifaceted needs within the CLVT scope of practice? Option A. Present a comprehensive list of all available low vision technologies and advocacy organizations, expecting the patient to independently research and select what is most relevant to their situation. Option B. Acknowledge the patient's emotional distress, offer empathetic listening, and then collaboratively develop an educational plan that addresses their specific concerns about their eye condition, low vision devices, and adaptive strategies, while also exploring relevant support resources. Option C. Immediately provide a detailed overview of various low vision devices and adaptive strategies, followed by a brief mention of support groups. Option D. Focus primarily on the emotional support aspect, offering reassurance and encouraging the patient to process their feelings without immediately delving into technical details about their condition or devices. The correct answer is C. Immediately provide a detailed overview of various low vision devices and adaptive strategies, followed by a brief mention of support groups. Explanation. This scenario presents a common implementation challenge for certified low vision therapists, CLVT in the United States, specifically concerning patient education and emotional support within the regulatory framework governing vision rehabilitation services. The challenge lies in balancing the immediate need for practical information about eye conditions and adaptive strategies with the profound emotional impact of vision loss. A CLVT must navigate this delicate balance while adhering to ethical guidelines and professional standards that emphasize patient-centered care, informed consent, and the provision of comprehensive support. The correct approach involves a multifaceted strategy that integrates education with empathetic counseling. This approach acknowledges that understanding an eye condition and learning new skills are intertwined with emotional processing. By first validating the patient's feelings and concerns, the CLVT establishes trust and rapport, creating a receptive environment for education. Subsequently, providing clear, accessible information about the specific eye condition, available low vision devices, and adaptive strategies empowers the patient. Crucially, this education is delivered in a manner that respects the patient's pace and cognitive load, with opportunities for questions and reinforcement. Connecting the patient with relevant support groups and advocacy resources further enhances their coping mechanisms and sense of community, aligning with the ethical imperative to promote patient autonomy and well-being. This comprehensive approach is supported by the Code of Ethics for Certified Low Vision Therapists, which stresses the importance of holistic patient care, including emotional support and resource referral. An incorrect approach that prioritizes immediate technical instruction without addressing the patient's emotional state fails to recognize the psychological impact of vision loss. This can lead to patient overwhelm, resistance to learning, and a diminished sense of agency, potentially violating the ethical principle of beneficence by not fully supporting the patient's overall well-being. Another incorrect approach, focusing solely on emotional validation without providing concrete educational information and practical strategies, leaves the patient feeling heard but lacking the tools and knowledge necessary for effective adaptation. This can hinder progress and may not fully meet the professional obligation to provide rehabilitation services. Lastly, an approach that offers information in a highly technical or jargon-filled manner, without considering the patient's comprehension level or providing opportunities for clarification, can be disempowering and counterproductive, failing to uphold the standard of clear and effective communication essential for informed decision-making. The professional reasoning process for CLVT in such situations should involve a continuous assessment of the patient's emotional and educational needs. This includes active listening, empathetic responses, and tailoring educational content and delivery methods to the individual's unique circumstances and learning style. Professionals should prioritize building a therapeutic alliance, ensuring that all interventions are delivered with respect for the patient's dignity and autonomy, and are consistent with established ethical codes and professional practice guidelines. Question 15. The efficiency study reveals that a client with low vision, who has expressed a strong desire for a specific, high-cost magnification device they saw advertised, is being assessed by a certified low vision therapist, CLVT. The client has limited understanding of the device's technical specifications and potential drawbacks, but is insistent on acquiring it. The CLVT has assessed the client's needs and believes a different, more cost-effective device, coupled with specific training, would be more beneficial for their functional goals. What is the most ethically and legally sound approach for the CLVT to take? Option A. Refuse to discuss the advertised device, stating it is outside the CLVT scope of practice, and proceed only with recommending the CLVT preferred device without further explanation of the client's initial request. Option B. Immediately order the advertised device as requested by the client, assuming their expressed desire overrides the CLVT professional recommendation and assessment. Option C. Defer the decision entirely to the client's family members, as they seem more knowledgeable about assistive technology and the client's financial situation. Option D. Thoroughly explain the features, benefits, and limitations of the advertised device, as well as the CLVT recommended alternative, ensuring the client understands both options before proceeding with a joint decision-making process that prioritizes the client's informed choice and functional needs. The correct answer is D. Thoroughly explain the features, benefits, and limitations of the advertised device, as well as the CLVT recommended alternative, ensuring the client understands both options before proceeding with a joint decision-making process that prioritizes the client's informed choice and functional needs. Explanation. This scenario presents a professional challenge due to the inherent tension between a client's expressed desire for a specific assistive technology and the certified low-vision therapist's CLVT ethical and legal obligation to ensure the client's understanding and informed consent, as well as to practice within their defined scope. The CLVT must balance the client's autonomy with the responsibility to provide appropriate, evidence-based recommendations and to avoid misrepresenting the capabilities of a device or the services they can provide. The correct approach involves a thorough assessment of the client's needs, a clear explanation of the recommended device's capabilities and limitations, and confirmation of the client's understanding before proceeding. This upholds the principles of informed consent, ensuring the client can make a decision based on accurate information. It also adheres to the CLVT scope of practice by focusing on assessment, recommendation, and training related to low vision rehabilitation, rather than acting as a salesperson or guaranteeing outcomes beyond their professional purview. This aligns with ethical guidelines that prioritize client well-being and autonomous decision-making. An incorrect approach of immediately ordering the device without confirming the client's understanding of its specific functionalities and limitations would be a failure of informed consent. The client might not fully grasp what the device can and cannot do, leading to potential dissatisfaction or misuse. Furthermore, if the CLVT overstates the device's benefits or implies it will fully restore vision, this would be a breach of professional integrity and potentially misrepresent their scope of practice. Another incorrect approach of deferring the entire decision-making process to the client's family without direct engagement and confirmation of understanding from the client themselves would violate patient confidentiality and the client's right to self-determination. Family input can be valuable. The primary responsibility for informed consent rests with the individual receiving services. A third incorrect approach of refusing to discuss the specific device altogether, citing it as outside the CLVT purview without offering alternative, appropriate solutions or explanations, would be a failure in advocacy. While the CLVT must operate within their scope, they also have a responsibility to guide clients towards appropriate resources and to explain why certain options may or may not be suitable, thereby advocating for the client's best interests within the bounds of their expertise. The professional decision-making process in such situations should involve 1. Active listening to the client's stated desires and concerns. 2. Conducting a comprehensive assessment to identify underlying needs and functional limitations. 3. Clearly and concisely explaining the features, benefits, and limitations of any recommended assistive technology, using language the client can understand. 4. Verifying the client's comprehension through open-ended questions. 5. Discussing alternative options and their suitability. 6. Documenting the assessment, recommendations, and the client's informed consent. 7. Maintaining professional boundaries by avoiding any actions that could be construed as salesmanship or guaranteeing outcomes. Question 16. Market research demonstrates that individuals with low vision often face significant challenges in their home environments. A CLVT is tasked with recommending environmental modifications for a client who has recently experienced a progressive vision loss and expresses frustration with navigating their home, particularly in the kitchen and hallway. The client is on a fixed income and has limited technical skills. Which of the following approaches best reflects the CLVT professional responsibilities and ethical obligations in this situation? Option A. Implement a comprehensive set of organizational changes and new lighting fixtures based on the CLVT professional judgment of what would be ideal, without extensive client input, to ensure the most impactful improvements are made quickly. Option B. Conduct a thorough in-home assessment. Collaboratively identify the client's specific functional needs and priorities within the kitchen and hallway. Explore a range of cost-effective and user-friendly lighting and organization strategies with the client, and provide hands-on training for any implemented modifications. Option C. Recommend the installation of the most advanced, high-lumen LED lighting systems throughout the home, including smart home integration for automated control, as these are generally considered the most effective for low vision. Option D. Provide the client with a list of general home modification resources and online guides for low vision, advising them to research and select the modifications they believe will be most beneficial. The correct answer is B. Conduct a thorough in-home assessment. Collaboratively identify the client's specific functional needs and priorities within the kitchen and hallway. Explore a range of cost-effective and user-friendly lighting and organization strategies with the client, and provide hands-on training for any implemented modifications. Explanation: this scenario is professionally challenging because it requires a certified low-vision therapist, CLVT, to balance the immediate needs of a client with the long-term sustainability and ethical considerations of environmental modifications. The CLVT must not only identify effective solutions, but also ensure they are practical, affordable, and align with the client's capabilities and preferences, all while adhering to professional standards and potentially relevant accessibility guidelines. The core challenge lies in moving beyond a purely functional assessment to a holistic approach that empowers the client. The correct approach involves a collaborative assessment and implementation process that prioritizes the client's active participation and self-advocacy. This aligns with the ethical principles of client-centered care, emphasizing autonomy and respect for individual needs and choices. By involving the client in identifying priorities, exploring options, and making decisions about modifications, the CLVT ensures that the interventions are not only effective, but also sustainable and empowering. This approach also implicitly considers the principles of universal design by seeking solutions that benefit a wide range of users and can be integrated seamlessly into the environment, promoting independence and participation. While specific U.S. federal regulations like the Americans with Disabilities Act (ADA) are not directly applicable to private home modifications, the spirit of accessibility and reasonable accommodation informs best practices. Professional guidelines for CLVT emphasize a holistic, client-driven approach to environmental assessment and intervention, an approach that focuses solely on the most technologically advanced or expensive lighting solutions without considering the client's budget, technical proficiency, or personal preferences is ethically flawed, fails to uphold the principle of client autonomy, and may lead to the abandonment of the modification due to impracticality. This approach prioritizes a perceived ideal over the client's lived reality and capacity, an approach that relies on generic recommendations found online without a thorough in-home assessment and direct client consultation is professionally negligent. It bypasses the critical step of understanding the individual's specific visual impairment, functional limitations, environmental context, and personal goals. This can lead to ineffective or even detrimental modifications, violating the CLVT duty of care. An approach that implements modifications without educating the client on their proper use and maintenance is incomplete. While the modification itself might be appropriate, the client's inability to effectively utilize or maintain it renders the intervention less impactful and potentially frustrating. This neglects the CLVT role in ensuring the long-term success and benefit of the modifications. The professional decision-making process for similar situations should begin with a comprehensive, client-centered assessment that identifies functional needs, environmental barriers, and personal goals. This should be followed by a collaborative exploration of potential solutions, considering a range of options from low cost to more involved modification, always prioritizing the client's input, budget, and capabilities. Education and training on the use and maintenance of implemented modifications are crucial for long-term success. The CLVT acts as a facilitator and expert, empowering the client to make informed choices that enhance their independence and quality of life. Question 17. Process analysis reveals a client expresses significant frustration with their current single-vision spectacle lenses, stating they don't help as much as they should, despite a recent, technically accurate prescription. The client reports difficulty with specific visual tasks, such as reading small print in varied lighting conditions and recognizing faces across a room. What is the most appropriate initial course of action for the certified low-vision therapist, CLVT, to take? Option A. Recommend a trial of progressive lenses to address potential issues with intermediate and near vision that the client may not be articulating. Option B. Immediately remeasure the client's refractive error and verify the optical center and power of the existing spectacle lenses. Option C. Conduct a thorough functional vision assessment with the current spectacle lenses in place, followed by a detailed discussion of the client's specific visual tasks and challenges. Option D. Advise the client that adjustment to new prescriptions can take time and encourage them to wear the glasses more consistently. The correct answer is C. Conduct a thorough functional vision assessment with the current spectacle lenses in place, followed by a detailed discussion of the client's specific visual tasks and challenges. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified low-vision therapist, CLVT, to navigate the complex interplay between a client's diagnosed refractive error, their subjective visual experience, and the limitations of prescribed optical correction. The client's frustration and perceived inadequacy of the current spectacle lenses, despite a technically correct prescription, highlights the need for a nuanced approach that goes beyond simply verifying lens power. The CLVT must assess not only the optical correction, but also the functional impact of the refractive error and the effectiveness of the chosen correction method in meeting the client's daily living needs, all while adhering to professional standards and ethical considerations. Correct approach analysis. The correct approach involves a comprehensive functional assessment of the client's visual performance with their current spectacle lenses, followed by a detailed discussion about their specific visual tasks and challenges. This approach is justified by the CLVT ethical obligation to provide client-centered care, which prioritizes the individual's needs and goals. The CLVT Code of Ethics emphasizes the importance of understanding the client's functional limitations and ensuring that interventions are tailored to improve their quality of life. By assessing functional performance and engaging in a thorough dialogue, the CLVT can identify whether the refractive correction is indeed the primary barrier, or if other factors are contributing to the client's dissatisfaction, thereby guiding appropriate recommendations for further intervention or adjustment. This aligns with the CLVT role in not just prescribing, but also ensuring the efficacy of optical correction in real-world scenarios. Incorrect approach is analysis. One incorrect approach would be to solely rely on a remeasurement of the refractive error and a verification of the spectacle lens prescription without further functional assessment or client discussion. This fails to acknowledge the client's subjective experience and the potential for other factors to impede visual function, such as visual field deficits, contrast sensitivity issues, or even adaptation problems with the lenses. Ethically, this approach neglects the client's reported difficulties and may lead to an incomplete or ineffective intervention. Another incorrect approach would be to immediately recommend a different type of spectacle lens, e.g., progressive lenses if single vision were prescribed, without a thorough understanding of the client's specific visual tasks and the reasons for their dissatisfaction with the current correction. This is a premature recommendation that bypasses the crucial step of functional assessment and client-centered problem solving. It risks prescribing a solution that may not address the root cause of the client's issues and could introduce new challenges or costs without clear benefit, violating the principle of providing appropriate and evidence-based interventions. A third incorrect approach would be to dismiss the client's concerns as simply a matter of adjustment to the prescription, without investigating the underlying reasons for their dissatisfaction. This dismissive attitude undermines the client's autonomy and their right to have their concerns addressed. It also fails to uphold the CLVT responsibility to thoroughly evaluate the effectiveness of prescribed optical corrections and to explore all avenues for improving visual function. Professional reasoning. Professionals should approach such situations by first actively listening to and validating the client's concerns. This should be followed by a systematic functional assessment that evaluates visual performance in the context of the client's daily activities. The CLVT should then engage in a collaborative discussion with the client to identify specific challenges and explore potential solutions, considering the refractive correction, other visual needs, and the client's preferences and goals. This iterative process ensures that interventions are client-centered, evidence-based, and ethically sound, leading to the most effective outcomes. Question 18. Quality control measures reveal that a certified low-vision therapist, CLVT, is evaluating a 6-year-old child with a recent diagnosis of a progressive visual impairment for the first time within an educational setting. The child is struggling with reading printed materials in the classroom and navigating the school environment. The CLVT needs to determine the most appropriate initial steps to support the child's educational and functional needs. Which of the following approaches best reflects the required professional and regulatory standards for this situation? Option A. Immediately provide the parents with a catalog of advanced magnification devices and optical aids, assuming that the parents can then guide the selection process based on their observations of the child's needs. Option B. Conduct a comprehensive functional vision assessment in the classroom setting. Gather input from the child's teacher and parents regarding specific academic and environmental challenges, and consider the child's developmental stage to inform the selection of appropriate interventions and assistive technology. Option C. Administer a battery of standardized low vision acuity and visual field tests to quantify the extent of the visual impairment, and then recommend a list of commonly used assistive devices for children with similar diagnoses. Option D. Focus solely on assessing the child's ability to read large print materials in a quiet, controlled clinic setting, as this is the primary academic task requiring visual support. The correct answer is B. Conduct a comprehensive functional vision assessment in the classroom setting. Gather input from the child's teacher and parents regarding specific academic and environmental challenges, and consider the child's developmental stage to inform the selection of appropriate interventions and assistive technology. Explanation: this scenario is professionally challenging because it requires a certified low vision therapist, CLVT, to navigate the complex interplay between a child's immediate functional needs, their developmental stage, and the long-term implications of their visual impairment within an educational setting. The CLVT must balance the urgency of providing effective interventions with the need for a comprehensive, individualized assessment that respects the child's unique learning style and the legal mandates governing special education services. Careful judgment is required to ensure that interventions are not only appropriate, but also ethically sound and compliant with established standards of practice. The correct approach involves a multifaceted assessment that prioritizes the child's functional vision in their natural learning environment, incorporates input from parents and educators, and considers the child's developmental age and cognitive abilities. This approach aligns with the ethical principles of client-centered care and the regulatory requirements for individualized education programs, EAP, under relevant U.S. federal law, such as the Individuals with Disabilities Education Act, IDEA. IDEA mandates a comprehensive evaluation to determine a child's eligibility for special education and related services, and the subsequent development of an IEP that addresses their unique needs. A functional vision assessment, which evaluates how a child uses their vision in everyday tasks, is crucial for identifying specific challenges and informing appropriate interventions. This approach ensures that the CLVT is gathering the most relevant information to support the child's educational success and overall development. An incorrect approach would be to solely focus on standardized low vision assessments without considering the child's functional performance in their educational setting. This fails to capture the real-world impact of their visual impairment and may lead to interventions that are not practical or effective for the child's daily life. Ethically, this neglects the principle of providing services that are directly beneficial and relevant to the client's needs. Another incorrect approach would be to immediately recommend specific assistive technology without a thorough functional assessment and consideration of the child's developmental readiness and the educational context. This bypasses the critical step of understanding the child's specific challenges and how technology can best support them, potentially leading to the selection of inappropriate or overwhelming tools. This violates the ethical obligation to provide evidence-based and individualized interventions. A further incorrect approach would be to prioritize the parent's immediate requests for specific devices over a comprehensive assessment of the child's needs and the educational team's input. While parental input is vital, the CLVT professional responsibility is to conduct an objective assessment and recommend interventions based on the child's best interests and functional abilities, in collaboration with the educational team, as mandated by special education regulations. The professional decision-making process for similar situations should involve a systematic approach. 1. Initiate a comprehensive functional vision assessment that observes the child's performance in their natural learning environment. 2. Collaborate with parents, educators, and other relevant professionals to gather a holistic understanding of the child's strengths, challenges, and goals. 3. Consider the child's developmental stage, cognitive abilities, and learning style when selecting assessment tools and interventions. 4. Identify specific functional deficits and areas where assistive technology or other interventions can provide meaningful support. 5. develop individualized recommendations that are evidence-based, age-appropriate, and integrated into the child's educational program, ensuring compliance with all applicable regulations. 6. Continuously monitor the effectiveness of interventions and make adjustments as needed. Question 19. Governance review demonstrates that a client presents with reported difficulties in sustained reading, frequent eye strain, and occasional double vision. The CLVT has conducted initial assessments. Which of the following approaches best reflects a comprehensive evaluation of ocular motility and binocular vision to inform intervention for this client? Option A. Administering a questionnaire solely focused on the frequency and severity of diplopia and eye strain to quantify the client's subjective experience. Option B. Performing a cover test and Hirschberg test to assess ocular alignment, followed by evaluation of pursuits and saccades for eye movement quality, and assessment of vergence ranges to understand convergence and divergence capabilities, all interpreted in relation to the client's reported reading difficulties and visual efficiency. Option C. Focusing exclusively on improving visual acuity through magnification devices, assuming that increased magnification will inherently resolve issues related to eye strain and diplopia. Option D. Recommending prism correction based on the client's subjective report of double vision, without conducting objective tests of ocular alignment or eye movements. The correct answer is B. Performing a cover test and Hirschberg test to assess ocular alignment, followed by evaluation of pursuits and saccades for eye movement quality, and assessment of vergence ranges to understand convergence and divergence capabilities, all interpreted in relation to the client's reported reading difficulties and visual efficiency. Explanation. This scenario is professionally challenging because it requires the Certified Low Vision Therapist, CLVT, to integrate findings from ocular motility and binocular vision assessments into a comprehensive understanding of a client's functional limitations, particularly concerning reading and visual efficiency. The CLVT must not only identify the presence of a binocular vision disorder, but also accurately interpret its impact on the client's daily visual tasks, adhering to the ethical and professional standards set forth by the CLVT certification body, which emphasizes client-centered care and evidence-based practice. The correct approach involves systematically assessing ocular alignment, using methods like the cover test and Hirschberg test to identify any deviations. Subsequently, evaluating pursuits and saccades assesses the quality of eye movements crucial for reading. Understanding vergence capabilities, convergence and divergence, is vital for sustained near work. Finally, interpreting the findings in the context of the client's reported symptoms of diplopia and eye strain and their impact on reading and overall visual efficiency allows for the development of a targeted intervention plan. This comprehensive, integrated approach aligns with the CLVT scope of practice, which mandates a thorough functional vision assessment and the provision of appropriate rehabilitation strategies. Ethical practice dictates that interventions be based on a clear understanding of the underlying visual issues and their functional consequences. An incorrect approach would be to solely focus on identifying a specific binocular vision disorder, such as strabismus or aphoria, without thoroughly investigating its functional impact on reading and visual efficiency. This fails to address the client's primary concerns and may lead to interventions that are not client-centered or effective. Another incorrect approach would be to rely solely on subjective reports of eye strain and diplopia without objective assessment of ocular motility and binocular vision. This lacks the necessary diagnostic rigor and could result in misdiagnosis or inappropriate treatment. Furthermore, recommending interventions without a clear understanding of the underlying binocular vision disorder and its impact on visual tasks would be unprofessional and potentially harmful, violating the principle of providing competent and evidence-based care. The professional reasoning process should involve a systematic evaluation. First, gathering subjective information about the client's visual complaints and functional difficulties. Second, conducting objective assessments of ocular motility, binocular vision, and visual acuity. Third, synthesizing these findings to identify any underlying ocular motility or binocular vision disorders. Fourth, correlating these disorders with the client's reported symptoms and functional limitations, particularly in reading and visual efficiency. Finally, developing a personalized intervention plan that addresses the identified deficits and aims to improve the client's functional vision. This structured approach ensures that interventions are targeted, evidence-based and client-centered, adhering to professional standards. Question 20. Quality control measures reveal that a certified low vision therapist, CLVT, is presented with a client who has a specific visual impairment and expresses a strong preference for a particular type of magnifier they have seen or used briefly. The CLVT must determine the most appropriate course of action. Which of the following approaches best reflects the professional responsibilities and ethical considerations for a CLVT in this situation? Option A. Conduct a comprehensive functional vision assessment to determine the client's specific needs and task requirements. Then recommend a magnifier that optimizes magnification power, field of view, working distance, and lighting, while educating the client on the rationale for the recommendation. Option B. Recommend a magnifier based primarily on its portability and ease of carrying, as this is often a significant factor for clients seeking low vision aids. Option C. Immediately prescribe the type of magnifier the client explicitly requests, assuming their preference is based on sufficient understanding of its capabilities for their specific visual needs. Option D. Select a magnifier with the highest available magnification power, prioritizing quantity of magnification over other optical considerations to ensure the client can see the smallest details. The correct answer is A. Conduct a comprehensive functional vision assessment to determine the client's specific needs and task requirements. Then recommend a magnifier that optimizes magnification power, field of view, working distance, and lighting, while educating the client on the rationale for the recommendation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified low vision therapist, CLVT, to balance the client's immediate perceived need with the long-term efficacy and safety of the prescribed low vision device. The client's preference for a specific type of magnifier, based on limited experience or a misunderstanding of its limitations, presents a potential conflict. The CLVT must navigate this by prioritizing the client's functional vision needs and adherence to established best practices in low vision rehabilitation, as guided by the CLVT certification standards and ethical guidelines. The challenge lies in educating the client and justifying a recommendation that may differ from their initial request, ensuring the chosen device is appropriate for their specific visual impairment, task demands, and environmental factors. Correct approach analysis. The correct approach involves a comprehensive assessment of the client's visual acuity, contrast sensitivity, visual field, and specific functional tasks. This assessment informs the selection of a magnifier that offers an appropriate magnification power, a sufficient field of view for the intended task, an adequate working distance to prevent eye strain and maintain comfort, and considers the need for optimal lighting. The CLVT then educates the client on the rationale behind the recommendation, explaining how the chosen magnifier best meets their needs and why the initially requested magnifier might be less suitable. This approach aligns with the CLVT ethical responsibility to provide evidence-based, client-centered care, ensuring the prescription of devices that maximize functional vision and promote independence, as implicitly required by the standards of practice for certified professionals. Incorrect approaches analysis. Recommending the magnifier the client explicitly requested without a thorough assessment, even if it appears to meet the stated magnification power, fails to consider crucial factors like field of view, working distance, and lighting. This approach risks prescribing an ineffective or even detrimental device, potentially leading to frustration, eye strain, and a failure to achieve functional goals. Deviates from the professional obligation to conduct a complete evaluation and provide a tailored solution. Suggesting a magnifier with the highest possible magnification power without considering the client's specific visual needs and task requirements is also an incorrect approach. Excessive magnification can drastically reduce the field of view and require an uncomfortably short working distance, making tasks impractical and potentially causing disorientation. This demonstrates a lack of understanding of the interplay between magnification, field of view, and working distance, which are critical for effective low vision rehabilitation. Focusing solely on the portability of a magnifier, such as a small handheld option, without evaluating its magnification power, field of view, or suitability for the client's primary tasks, is another flawed strategy. While portability is a desirable attribute, it should not supersede the functional effectiveness of the device in addressing the client's specific visual challenges. This approach prioritizes a secondary characteristic over the primary goal of improving functional vision. Professional reasoning. When faced with a client preference that may not align with optimal functional outcomes, the CLVT must employ a systematic decision-making process. This involves 1. Conducting a thorough, individualized assessment of the client's visual status and functional needs. 2. Applying knowledge of various magnifier types, their optical properties, magnification, field of view, working distance, and their suitability for different tasks and lighting conditions. 3. Educating the client about the assessment findings and the rationale for the recommended device, addressing any concerns or misconceptions. 4. Collaborating with the client to reach a mutually agreeable solution that prioritizes their functional vision and well-being, while adhering to professional standards of practice.